Okay, this is me signing back on in the dark, sitting and watching TV. Uh, it was 3 weeks ago Monday uh, from my surgery. So this is actually Tuesday. So it's 3 weeks and 1 day since I've had surgery. I had my surgery. Um, Everything's going well. I went back. I got a new brace for my leg. Last night I was in the bed. Pain usually through the night is around a 4 or 5, and wore the old brace to bed. Continue to keep it on my leg to keep my leg protected because I don't want to turn and distort my leg while I'm resting and cause re-injury to my leg. So I keep the night brace on, and only had to use pain medicine, a half a Percocet. One time through the night and one time during the day today. So the pain is diminishing somewhat and able to tolerate it. And I actually got in my car and with the range of motion brace, and with my sister and my daughter got in my car, and we rode out to the store and grabbing some food and returned home. So yeah, so it's doing better. Still pain, still have to use my precautions, still at toe touch. Of course, you know, the leg, because the leg is not being moved through the full range of motion, you'll have some muscle loss, you'll have some atrophy, because your one thing that keeps your muscle integrity is movement and blood flow, and when you're not moving through the full range of motion, you can't continue to keep your muscle density or waste away. You call muscle wasting. So I've actually lost some muscle mass in my thighs because of lack of movement to some degree. I'm not concerned about that as much right now because actually I've lost weight too. I've lost 10 pounds because of less food intake, and I'm a personal trainer, and I'm an old bodybuilder, so I don't do as much. When I'm not as active, I don't eat as much, or I don't train, I don't eat as much. So I become a smaller version of myself. I stay conditioned, but I just lose body weight and, some musculature. I think that's pretty much normal though. High in calorie intake, increased calorie intake, increased weight, less calorie intake, less weight. So that's kind of what I'm dealing with. But everything's going good. Like I said, we got a follow-up in February, which will be additional 2 weeks. So it'll be 4 weeks apart to go back for the next follow-up on it. But other than being like I said, the pain is is reduced. Taking less pain medicine. Feeling more like myself, but still have to wear the brace and use the crutches and do other precautions because I'm not ready to put any weight on the leg yet. But everything's going well. So you guys stay tuned, and we'll keep you up with any new things that happen or abnormal things. And I still have numbing on the outside of my leg. Excuse me, I'm a therapist, so sometimes I have a tendency to start talking technical, but the lateral aspect of my tibialis, I'm having a little bit of numbness still, but they told me that was normal because they had to sever one of the nerves in order to get the correct anchor on to putting the patella tendon back intact. So I got that little numb in there, that a little soreness too along the upper part of the knee up around the patella. Got some soreness there, but everything else feels pretty good considering the time it's only been 3 weeks. So I'm looking up, and I'm feeling blessed, and going to continue to just try to rehab and fill you guys in. So if you ever have to go through this journey or have anyone that does go through this, you can always refer to this video to kind of give you everybody's different, but it'll give you some kind of overall ideal of what's to come or make it come. And so it's a little easier when you kind of have some idea of what you're going to go through instead of going through it blindly and day to day. So hopefully this will be that informative piece you can share with your friends or look at if you have any questions or anybody else. Thank you for tuning in, and we'll keep you guys posted. Have a blessed evening.